everyone, in this video we're going to talk about what to expect when you're in Fundamentals Clinical. So in Fundamentals Clinical, I know it's really nerve-wracking because this is your first clinical on the floor as a nursing student, but don't fret. You're not supposed to know what's going on just yet. That just rhymed, that's funny. But you're not. This is fundamentals, this is when you're learning. So a big part of fundamentals is doing research. So typically you'll go in the night before, you'll get your patient, you'll understand what diagnoses they have, what meds they're on, any precautions, things like that. And then you go home and you take 2 to 4 hours to research so that when you walk on the floor the next day, you know what is going on with this patient and you understand, why they're on these precautions, what the pathophysiology of these diseases are. And that's really important because a lot of, I don't want to say every patient is the same, but there are certain things that you're going to see over and over again. And for example, like chronic heart failure, there's a ton of patients with CHF. So when you see these things at a fundamental level, you're like, oh my gosh, I have no idea what this means. But then when you go and you research it, you understand, oh, that's why they have, edema in their feet, or that's why there's crackles when they breathe. So when you understand those concepts, you can better serve your patient. But at the fundamental level, things are pretty slow in the clinical setting. You feel like they're fast, because it's all new to you, but you're not doing nearly what you would do in a med-surg clinical or as a nurse. So don't fret that you need to be this amazing nurse from the second you walk on the floor. You're just learning, and your clinical instructors know that as well as your teachers. If you just show that you're putting your best foot forward and you're trying to learn, it's okay to make a mistake. Just obviously don't, hurt somebody, obviously. But, if your clinical instructor asks you what something is and you don't know, say you don't know. That's perfectly fine when you're in fundamentals. Things that you learn in fundamentals are, basic, precautions. You learn about, the kind of basic principles of nursing, like the bed should always be in the low position, make sure the call light's on, what do you do if you notice that your patient is having trouble breathing, what are some things that you need to understand about the elderly patient. So these are really just setting the foundation for your nursing practice. So what I would say to somebody going into Fundamentals Clinical is to do really good research the night before. Make yourself med note cards and keep them throughout your nursing clinicals. And what these do is whatever meds your patient's on, kind of like you make your own little med card that tells you what the med is, what the adverse side effects are, what are certain things you have to look for, like some meds can't be given with grapefruit juice or, can't be given with Tums. Make sure you know those basic things. Make sure you know that if you're given, a cardiac med, that if you need to check the heart rate before, things like that, so that you can really set that basis for your practice. Also, I think that fundamentals is a great time to really get confident in your vital sign taking skills. So I know it can be very nerve-wracking to go into a room and talk to a patient and be like, hey, can I take your vitals? But, just explain to them, this is my fundamentals nursing rotation, and, I'm learning how to take blood pressures. Would it be okay if I took a manual blood pressure on you? I mean, a monkey can go in the room and set up a blood pressure cuff and press a button and write down what it is, but can you do a manual? Are you going to be able to do a manual when a patient passes out, and there is not an automatic blood pressure cuff around, or the automatic blood pressure cuff is giving you a really funky reading and you need to make sure that it's correct. You need to be able to do a manual. And I'll tell you, it's funny because I'm a pretty good student, but the first time we did vital signs pass off in skills lab, I was actually one of the only students that had to come back and redo the blood pressure, because I just got so nervous. And I think that was my big thing in fundamentals. I was just always so nervous that I was gonna mess up. But I realized after that semester that fundamentals is the time that you're sort of allowed to mess up. I mean, not on a patient's well-being or anything like that, but in the skills lab and things like that, they know that you're not gonna be perfect yet. You just learned this a week ago or 4 days ago. Any kind of skills lab pass off, don't be too worried about it. Just study it, and perform. And you know, if you mess up, they're not going to fail you right on the spot. They're going to give you a little bit of leeway. When you get into later semesters, they won't let that stuff fly. But so yeah, I would just say in the fundamental clinical setting, work on your therapeutic communication. There's some really good sheets online that you can print out to really learn how to talk to patients and be understanding of their circumstances and their, you know, a lot of patients in the hospital are in a crisis situation. Excuse me. Also practice your vital signs and, you know, really try to organize your priority of care, like your head-to-toe assessments. What I found super helpful is I printed out a form that explained how to do a head-to-toe assessment and what to look for. And I would just go through that with my patient, and that way I would learn how to do a thorough head-to-toe. So that's what I'd say for Fundamentals Clinical. I hope you found this video helpful, and make sure to subscribe to my channel. All right, until next time.